Good afternoon, everybody. Welcome to a new seminar in an online series organized by Inclusion Europe in response to the coronavirus emergency. My name is Milan Čořep. I'm Director of Inclusion Europe. And today we'll be talking about the situation in Italy and the impact of the coronavirus emergency on people with intellectual disabilities and their families in Italy. And we'll have our colleagues from Anffas, our Italian member, Daniela and Gianfranco, to interview about this and to tell us more about what's going on in the country. So welcome to Daniela and Gianfranco. I'm very happy that you found the time to join us today and to talk us through the situation in Italy. Let me start by saying that, of course, we all watching closely what's going on in the country with, of course, a great concern and admiration for the way that you are dealing with the situation, and express our sympathy as well. But of course, that's through the news. What we would like to do today is to learn from the experience of Anffas, your members across the country, what the situation is directly, what the impact is, with the view that, of course, there are lessons that can be learned from other organizations in other countries in this experience. So let us start by asking, what is the situation like today? What is actually, how would you describe the situation in Italy today?
Hi to everybody. The situation is not resolved at all, obviously, and we are trying to resist, and especially in the northern of Italy, there are so many problems, and we are fighting like as everybody in this moment, and we are continuing to work to support all the people with disability, especially with intellectual disability, and their families to resist and to face up all this emergency, all this situation, and we are working in a lot of fields, political, health care, so all about hospital, schools. We are doing all the possible in all the fields. But I want to say that the most important things that we did since the beginning of this emergency is that we are not leaving the families and the local organization alone. And for example, we have our director that every day is calling all the president of the local organization to know all the singular situation and to know if there are particular problems. So the families, the person with disabilities, and all the support person, the operators, they are not feeling alone in this moment. And then we are working so hard in the political field. So we have studied all the decree, and we have trying to improve, to do better for all the people with disability and their families.
And based on what you are describing, which of course it affects many areas of your work and of the lives of people with intellectual disabilities and their families. But from the let's start from, let's say, the end of what you were saying now, the political side of things. What are the things that you would like to highlight as things that you were targeting, you were communicating, doing the advocacy work, and possibly doing some changes to the regulation?
One of the things that we did, for example, is to ask to pay attention about the hospitalization, because it's not easy for a person with disability to be hospitalized, and we ask to find adequate assistance in hospital, and to find a special person trained for that, to assist and support the person with the intellectual disability or autism or etc. To adapting himself in this new situation, and to be like a contact point from the person and the families, because the problem is that once they are hospitalized, it's hard for the family to be in contact directly with the person as for the others. So this is a big problem, especially when they are in intensive care.
Has this changed? Did you succeed in convincing the authorities that this would need to change, or is the situation still the same?
We are trying. It's not easy, because we are Anffas with other 151 organizations asked to have support from, for example, from the beginning, from the transportation in ambulance, since all the other procedures. So we are trying. It's not easy because it's not, we need time here. It's not so easy to make a changement. So for example, also for the schools, all the students, the schools are closed since the 3rd of March, and now students are studying in a distance using digital platform, etc. And for the students and for the teacher has been difficult to adapt themselves in this new situation, because it's a new way to study. And for students with disability, needs more time that the other students, because they need they had other situation. They had the support person, the support teacher. We have a special figure that is the specialist for autonomy and communication, that usually works with the student with disability in the classroom. So now it's difficult to have this figure in house with the students. So it's we are not in Italy. It's not so fast to have a changement in this way, but we are working.
So education is obviously one of the areas that is heavily impacted, and there are not that many examples of the distance education reaching out to students with intellectual disabilities in any countries. So in this sense, I don't think Italy is very different to the rest of Europe. Are there any sort of positive examples of education being provided to students with intellectual disabilities at all, or is that completely out of the question at the moment?
We are trying to create some situation in which students with disability could go alone in the classroom in the same school that where they have the assistance. So it's some work in progress. Because
so this could be one of the solutions that you are working on, is to allow for the children with disabilities to actually be able to go to the schools.
Yes, because the problem is that we have few assistants in houses, also because maybe relatives are scared from the infection. But the few assistants that we have here have been all activated, created by Anffas.
Maybe going back to the initial topic that you mentioned, and that's the situation and support to families, to people living all over Italy. What are the let's say most typical situations that you hear back from your branches all over Italy? What is the impact on families in general?
The big impact that they feel alone because suddenly they have been closed in the house without the possibility also to go out. But now, after a big Anffas stressed a lot in this way because in the political fields, I mean, to allow all the people with intellectual disability, especially with autism, to exit. So with one relative or one parent, etc., because they need that. Also because most of them don't understand why they have to, the reason they have to be closed in the house. And so now they have the permission to exit with a self-certification, and so this is one of the results that we obtain, but we stressed a lot.
And this is also that's good to hear, of course. But this is one of the typical situations being fought in many countries as well, to gain the exception for people to be able to go outside.
Yes, another good practice, I don't know if we can call it good practice, but we know that, for example, in one of our local organization, I think that it's in Puglia, I hope not to say the wrong things, the social worker and the support person decide to remain in the organization with the people with disability, to maintain all their habits, all their activities, and not in order not to stress them. And of course they can stay in touch with their relatives and their parents, calling them or with chats, or as we are doing now. And another thing that we are doing is to created a lot of the social worker and the support person are created a lot of WhatsApp group, for example, to have a continuous exchange with all the person with disability, to let them talk about their days, what they are doing, maybe to do some activities together to show the results, and in this way they are not feel alone, and they are a little bit less stressed. And we have also some guidelines and some person of our quarter that are doing some activities also for the stress tool to explain how to manage the stress in this kind of situation. And we have realized a lot of easy to read and augmented communication information to make people with disability understand what is now the situation and the reason we are all in house and we can go out. Another important thing that Anffas is trying to do at referred to the government and to the parliament is to make the residential institution comparable to the hospital facilities, in order, like the hospital, to have all the dispositive and to prevent infection, to avoid to spread the contagions. because one of the big problem is also that we have not enough personal dispositive. So Anffas is trying to do this at government and parliament level.
And thank you. You've actually brought up another topic I wanted to ask about, and that's the situation of people in residential institutions. Let's say lack of the personal protective equipment, both for the residents and for staff, is one of the issues that you already mentioned. We also heard stories, I think most recently from Sicily, about quite a dire situation in some of the institutions where a lot of people are infected. In more general terms, do you know more stories like this? Is that a real like, do you have some idea about the numbers of people in institutions that might be in already infected or in this kind of position? Because and not only in Italy but in other countries, it starts to is going to be quite a significant.
Yes,
problem.
I don't have a precise number, but I know that there are, and we, as the Anffas, we have created a purchasing group to buy all the dispositive, to give this dispositive to all the organization in Italy. Because it's a real big problem, and it's a problem that we highlighted to the institution, to the government since February. We Anffas asked to pay attention in this to these things, and the problem is that Anffas buy this dispositive, but often the civil protection requires them to use for example, in the hospitals. So it's a real big problem that we are trying to resolve.
And that I guess leads me to another question, and we've seen in different countries also situation of how medical care is or isn't provided. Is there anything, you have any sorts of information about people with disabilities being denied medical care on the grounds that,
Yes, I understand. We are trying to collect this kind of information. We know that they have some difficulties. The problem is, what we know for sure is that often people with disabilities, intellectual disability, once they are out the intensive care, they are often dismissed from the hospital too early, and the hospital, it's like the hospital asked to the residential institution to taking care of them after they have been in the hospital. So they used to dismiss them too early. Because they think that the residential institution could take care of them, but it's another big problem.
Yes, so sort of early release on the premise that the residential institution can kind of function as a medical establishment, which I would think that it endangers the other residents in the institution as well if they are released too early and potentially still infectious.
Yeah. Yes, exactly.
Okay, thank you. I think that's it's been quite a comprehensive overview of the situation and topics that you've been working on. Is there anything from your experience that you would like to specifically highlight for other countries, other organizations to pay attention to specifically don't forget based on what you experience now?
Maybe what I said at the beginning, just not to live alone, or the person with disability and their family, and to stress the more possible the government and all the competent institution to obtain something, because here it's a slow process. So I don't know in the other country, but here it's a slow process, and instead we need to be speed. And we are working with the National Office for Promotion of the Rights for a disability person, and we are working all the day, all the night. So maybe that don't leave alone the family and the local association, and stress as much as possible.
Thank you. Thank you very much for the comprehensive view, for the information you provided. I think that that could be that for this part of the session, and I'd like to invite all the participants that would like to comment or ask your own questions.
Hello, hi Daniela. Can you hear me? Hello.
Yes, we can hear you.
Yeah. Good. I just wanted to ask you, you provided some great examples on how professionals were trying to maintain the contacts with people with disabilities and the families when these people were kind of stuck like at home, like for this couple of past of weeks. As you mentioned, the residential care institutions, I wanted to ask, in this kind of particular situation, how professionals enable the contact between the person with an intellectual disabilities and his or her family during this period where that can cause a lot of stress and anxiety.
I think that they are obviously now the accesses are limited to avoid the infection. They use as we are using now the internet and the various chats, and so they can still in touch. And they can use the telephone, all the way possible to keep in touch the person with disability with their relatives.
I'm the president of Inclusion Europe. Daniela, I'd like to ask you also about these contacts, because I'm in Finland, I live here, and we have opened several ways to our members here to have contact with our association, and the only way actually now to tell about these contacts is via internet. And there are many members who don't use internet, old people who don't know anything about internet. So how do you reach the older members?
No, we are keeping in touch with all the organization, not just by internet, but as I said before, there is our director, our general director, that every day is calling by phone all the presidents of the local organization to know what is the situation in their region, in their cities, because obviously maybe a lot of families have not internet, they can't get email, but they used to call directly the local association and the president. I think that it's important, very important. We are the point contact between the organization, the members, the families, and the local authorities, because one of the big problem is that the local authorities often don't answer to the organization or to the families or to the person. So we are the point of contact between these two entities, so the organization, the people, and the local authorities.
I have a question on the chat. Hi there, I would like to know a little more about the education area of your discussion. You were saying that they are starting to open classrooms for one person with disability and their assistant. Wondering how that happens and how it gets chosen, who the person is.
Gianfranco remind me that we have a platform, a digital platform on the website of the minister, and we every student could access and find all the support materials, and we are offer also our we are available to offer the possibility to have easy to read materials to the students with disability, and we are available also to offer our experience about the teaching at home, because a lot of students maybe are ill and they couldn't exit now.
Okay, thank you. We also have two questions about families, and you've already mentioned, of course, the importance of staying connected and supporting them. There is a question, I guess, maybe for some other specific ideas of how this support works. How could we provide appropriate respite for the families within the lockdown limits?
In the same way that we support people with disabilities. So our social worker, our support person, use not to speak to just to the people with disability, but also with their families. So they are they listen all to the needs and to the worries of the parents and the relatives, and they are trying to help at a psychological level. And also Anffas, on our website you can find a lot of guidelines and handbook in this way, and also information just for the families, how to manage the stress and the isolation that in which they are now.
Okay, so thank you. Maybe just to also make it very clear, is it possible for the support workers, social workers to actually visit the families, or is this prohibited?
Gianfranco is telling me that it's possible, but they have to follow, obviously, all the health measures that the health minister decides. So they have to keep the social distance, and they have to have masks and gloves, all that the health minister decide.
Okay, thank you.
But the problem is that we have not tests, so we could know if in the most of cases we can know if a social worker, a support person is positive or not. Also, if he is or she is asymptomatic.
Okay, thank you. Was another question about families, working with families directly, and from your dealings with families and then your support, what have been the biggest concerns the families are voicing?
I think that they have suddenly be alone and without the activities, the daily activities for the person with disability, and in a lot of cases also without the health assistance. So these this has been the biggest problems. And we are trying to resolve, because it's not easy, because, for example, a lot of care service are not dialogue now, so it's difficult to have the basic health service.
Okay, well, thank you for those who posted your questions. And one last topic I would like to ask about. We are talking about the situation in Italy, of course, and then what you would, based on your experience, also like to highlight for others. I would like to close this conversation by asking you what you would think would be the best way of supporting your work coming from the European Union. You know that there is a lot of discussions about funding and let's say the economic measures and some other measures that the Union is taking. Is there anything specific that you would expect from the European institutions?
I think that we are all expecting some attention and some support relating to the needs of the people of disabilities and their family. For example, we are working now on about the launch of work benefits for the parents or the relative of a person with disabilities who has to stay at home now, or economic guarantees for all the workers with disabilities. So, I mean, maybe we are all waiting to have some support and assistance and to see the rights respected.
Okay, thank you very much. I think there's some activities already being done on this. I just want to highlight that just today, the three commissioners, Schmidt, Dali, and one more, released a letter directed to the national governments, specifically urging them to use the financial instruments they have at their disposal now to make them available for people with disabilities, families, and other so-called vulnerable groups. So just to highlight this fresh development here, there is some communication from the European Commission coming to the national governments to highlight the need to support these groups of people directly. Well, I want to thank you both, Gianfranco and Daniela, very much for your time and for your work. I found this exchange very informative and very useful. I thank you very much for your attention. Thank you both for your contribution, and I wish you a nice day and stay healthy and safe, and hopefully this will be over soon enough.
Okay, thank you.